95.9 WATD, this is Down the Shore's Morning News. It's a Thursday, and the doctor is in the house. Dr. John Hayes joins us every week at this time. For a better experience at the doctor's office, try Dr. John Hayes' new highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com, drjohnhayesjr.com. Dr. Hayes, good morning.
Hey, Rob. Hey, Beth. Good morning.
How are you?
I'm doing great, guys. Good to be here.
Yeah, good to have you in here on this first official day of summer.
Yes, we'll take it.
Should be fun. All right, so the topic today is animal product consumption and prostate cancer. Oh, boy.
Yeah, so it's a big issue. It's a serious issue. Unfortunately, it's one of those issues that in our society we don't tend to hear much about because... If we take
like animals.
we consume a lot of animal products. But I think probably the smartest thing I do is just kind of give you a big overview first and a takeaway. Because what I did this morning in partial preparation for this is if you just go to Google and you search like the China study and prostate cancer, that brings up just a whole list of studies that link essentially diet, lifestyle to prostate cancer. Prostate cancer is huge. It's the number one cancer in men in this country. In other parts of the world, China and Japan in particular, the incidence of prostate cancer is far less.
Okay.
So in societies that consume a lot less animal products, mainly saturated fat, but also dairy products, those are the two big offenders.
Okay, so that would be, you'd say, obviously the question to ask would be, why does it happen more in some places than others? And I guess that would come to diet and maybe lifestyle.
Yeah, sure.
Diet would be a big one. And we're always told, or at least the reports are, the Western diet, it contains a lot of beef, or, and is that red meat?
Yeah, and the saturated fat that goes along with it is a major, major risk for, we talked about heart disease extensively, vascular disease, and prostate cancer especially. That appears to be the biggest link in studies across the board when looking at meats and prostate cancer in particular. But there's more to it. So in our society, it's not just red meat. It's if you eat dairy, whole dairy especially, and if you consume butter, that type of thing, products that have a lot of saturated fat, place us at a higher risk for developing prostate cancer. Other things place you at risk. If you have had previous infections, that places you at risk. Bad genetics places you at risk. Certain vitamin and other nutrient deficiencies can also place us at risk. But two of the biggest ones, again, are saturated fats, red meats in particular, and also dairy products. One of the things with regard to dairy, cow's milk in particular, is that it does increase the body's production of IGF-1. And IGF-1, insulin-like growth factor, can be, and it's a well-known cancer promoter. This has been a big concern for a long time. So the China study was done many years ago, and a book was subsequently published on the topic called the China study. And they talked about a lot of what I just mentioned, and that is in societies that consume high amounts of milk versus societies that consume far less, the incidence of prostate cancer and other cancers in women and men, as we'll talk about next week, it's very, very important to note. And again, it's very sad that this is an information's been around for a long time, but it's not talked about often enough. We hear a lot about prostate cancer. We have this new advanced treatment. We have this. We have that. With radiation surgery, that type of thing. Nobody's talking about prevention, which is sad.
Right.
So this is one of the things I'm really, really trying to get the word out on, emphasize.
Yeah.
I talk to all my male patients all the time about this because it's a big deal.
Okay. Yeah, you're right. I guess typically we hear about, get screened and get, but we don't.
No.
It's just that you're going to get prostate cancer probably if you're a guy.
Wow.
Yeah, and it's sad because it doesn't have to be that way for a lot of people.
Okay.
So are non-dairy alternatives, would you promote that?
The only non-dairy, that's a whole other topic which we could talk about.
Because I feel like
because non-dairy alternatives can have estrogen in it.
They can have a whole lot of other crap in them, unfortunately. Seed oils being one of the biggest, which are pro-inflammatory.
Right.
Yeah, someone said almond milk is maybe not that good. And
no.
It's highly processed, the non-dairy stuff.
Yeah, with the exception being whole soy milk. So whole soy milk is probably very, very not only beneficial in many other ways, but may actually be protective for certain cancers because of the isoflavones, which are a substance in there that can help reduce the body's risk of cancer. But again, so much of this is related to what do we do most of the time. And again, it's not like you don't worry if you're going out and you have occasional steak dinner, that type of thing. You want to worry about what you're doing most of the time. That's really the big deal.
Because I do think about steak dinners.
Yeah,
me too.
Don't worry about once
barbecue season. Well, how often is it okay?
Let's talk about numbers here.
I guess, what would you recommend? Because
I eat beef like once a month.
I'd recommend none.
Once a month?
I mean,
like maybe like 2 to 3 times a month, but like
wow.
Personally,
well, I guess Beth is doing better than I am already. But,
personally, being a physician, I recommend none. Because I read this stuff all the time.
What do you recommend?
I recommend
a vegetarian diet.
Yeah. Well, close.
Yeah.
Close.
Okay.
Oh, close to none? Mm-hmm. Close to no red meat? Mm-hmm. Okay, gotcha.
Wow. That's what I recommend personally.
Okay, so no ribeye,
it's
no
summer
prime
barbecue
rib.
season, though.
Well, it's
rib roast. Okay.
So do you think
fish to an extent?
What about pork?
So pork seems to have less of an effect. When you look at some of the studies that I mentioned earlier, Beth, when you take a look at pork consumption, it seems to be less than beef. But I'm not so sure if there's manipulation in those studies.
Right.
I mean, if you do a deep dive into who sponsored the study, that type of thing.
It depends on the cut, too.
What about a chicken? They have those chickens at the supermarket.
Yeah, chicken generally has far less saturated fat, but there are other issues with regard to hormones, the difficulty that our bodies have in processing.
We can't win. So do you think a vegan diet is most advantageous?
Fish? We didn't mention fish.
Yeah, fish is very good.
Well, fish to a point can be good. And, there are concerns about fish now. One of the biggest concerns about fish, unfortunately, is microplastics.
Oh, right.
And microplastics and heavy metals. And
microplastics, are in everything.
It's a big
including
issue.
us, I guess.
Yeah, absolutely. And now they're finding microplastics in blood clots.
Yeah.
Human blood
that's
clots.
Crazy.
So it's a big issue.
Do you think skim milk is better? Is the best?
Not necessarily, because you have the other factors in dairy that are linked with cancers. Honestly, I tell patients all the time, unless you're allergic, for most patients, soy milk is the best.
What about, because I know I want to mention, because Beth, you were saying you love eggs.
I do love eggs.
We didn't touch on eggs. What about eggs, because there's good protein, right?
There is, and there are some studies that have actually linked prostate cancer to eggs, and there are some studies that nullify that. So that one's not as clear.
At this point.
At this point. But again, when you take a look, you do a deep dive, who's sponsoring the study? What's in there? How many people was it?
Yeah.
Which part of the world was it? That type of thing. As physicians, now more than ever, we have to deep dive into everything and just take a hard look at.
They've been flip-flopping on eggs for years, because at first they're like, oh, the yellow part, really not good for you. And then I think 2 years ago, they're like, the yellow part's not so bad in moderation.
So,
the yolk, I mean.
So I think,
I know what you were saying.
So for most people, moderation's key. So when you take a look at worldwide, so if you take a look like European populations, those that generally follow a Mediterranean diet, very high in plants, healthy fats like olive oil in particular, a lot of fruits and vegetables, that type of thing, their incidence of cancers is lower than ours. We know that for a fact. So that, if you want to talk about moderation, the Mediterranean diet is the diet that's been studied larger than any other diet in the world. However, there still are, again, the risks associated with, red meat and dairy in particular, and animal products in general that we all need to be be aware of.
Yeah,
is there anything you can eat more of to maybe offset?
Absolutely.
Steak?
Leafy greens.
Leafy greens for sure.
Yeah.
Other vegetables. Some of the best vegetables, broccoli in particular. Broccoli can be high in protein.
Right.
Peas, lentils, beans, those types of things. You can make a lot of very, very healthy Mexican-style dishes.
I do like beans, it is good.
Exactly. And variety. Nuts in relatively small amounts, moderate amounts, walnuts in particular, can be very, very healthy. And just, for looking at alternative plant sources, you can take a look at things like tofu. Tofu, unfortunately, is overlooked because there's a number of different ways you can do it. You can use it plain, you can buy the soft, you can buy the firm, you can buy the marinated, you can marinate it yourself. It's not bad.
I like
it really
tofu.
Isn't. Yeah, if you go some of the Thai restaurants are phenomenal in how they use it and prepare their meals.
Well, you know what? I made panko-crusted tofu tacos a couple weeks ago.
Wow.
I did fry them, though, so maybe that kind of eliminated the healthy advantage of tofu. But
not totally.
It was really good.
Yeah, I bet.
Yeah.
Sounds great. Yeah.
Yeah.
Yeah. Well,
there you go.
There you go. That's something
like
to try.
Good
I
recipe.
feel like I don't know. I guess I'm probably tofu has kind of got a bad reputation, right?
It has.
has.
Yeah.
I mean, it's just when you say it, you just automatically think whatever comes to your head.
In Asian restaurants, it's really delicious.
I'm sure it probably
Yeah.
is if it's prepared a certain way.
I mean, that's the thing. When you go to some of these Thai restaurants in particular,
it's so good.
It's phenomenal.
Yeah.
And the way that's prepared, the number of ways that you can use it, and so on and so forth. And you eat the meal, you feel great, you feel alert.
You feel lighter afterwards.
Exactly. Right.
I do choose it as my main protein sometimes.
There you go.
Yeah.
Oh, wow. Okay. All right. Well, Dr. John Hayes is with us, and you can read more, by the way, on his blog as we've been talking animal product consumption and prostate cancer and that relationship. Again, it's a topic you want to certainly read more in depth on, and he's got the full blog up there at drjohnhayesjr.com, drjohnhayesjr.com. And, of course, people can call and text Dr. John. He has his practice right in Marshfield, right?
Absolutely. Right up the street.
781-659-7989, 781-659-7989. And Dr. John Hayes is with us, by the way, every Thursday at this time in studio on WATD. Thank you, Doctor.
Thank you, Rob. Thank you, Beth.
Thanks, Doctor.
Take care.